Welcome, ladies and gentlemen, out to Fairview Park Hospital. We're here with Dr. Francisco Jacome. And
Hi.
Dr. Jacome has joined us a couple of times with seminars, doctor, and we appreciate those. Diverticulitis, you did some on weight loss, I believe.
Yeah, I've done diverticulitis, weight loss, gastroesophageal reflux disease, and now hernia.
So tell everyone what your specialty is.
Yeah. I am a general surgeon. I'm specialized in laparoscopic surgery and bariatric surgery. So I do basically what that means. I do the common procedures minimally invasive. So not cutting people open anymore, just through very small incisions, which makes the recovery way faster and the ability to go back to work faster, as well as the benefit of not having as much pain.
Doctor, how long have you been associated with Fairview Park?
We've been here, I've probably been coming for 2 years now. I believe actually 2 years this past March.
So a lot of people are getting to know you. A lot of patients have come to you and had success, I'm sure.
Yes, we've performed a large amount of surgeries already here.
And doctor, when we look at opportunities to be able to help the community, we look at different things, and just today you're doing a seminar on hernias.
Correct.
A lot of people don't even know what a hernia is. We've heard that word many times before, but how would you describe what a hernia is?
So a hernia is, let's put it this way, a lot of patients, the way they feel a hernia is through a bulge. So the person has a bulge, has something that is feeling that shouldn't be there. And the common thing that I hear from patients is, can you cut my hernia off? The reality is that the hernia is not the bulge. The hernia is actually a defect or a hole on the abdominal wall. And the bulge is the insides that protrude through the hole into the tissues underneath the skin. And that's why the patient feel a bulge. And one of the characteristics of a hernia is that it can come out and you can push it back in. So the actual hernia is not a bulge, it's a defect or a hole on the abdominal wall, which most commonly can happen at the belly button, or it can happen on the groins, or patients that had surgery in the past, it can happen where the incisions were before.
So is it all of a sudden a hernia, or is there some signs that would be, warnings?
Usually when patients realize that there is a hernia there, it's because they already have a bulge.
Okay.
That's the way it comes. Now, there are several screenings where small hernias can be picked up, and there is something called a sports hernia, which was very popular before. There's still a term that we use for it, which is a weakness, especially in the area of the groins on people that do a large amount of exercise, that tend to become very thin and in the future will become a hernia.
Okay. So how would you describe that particular feeling? That strain or?
Everything depends on where the hernia is. Usually the bell button hernias, the way patients discover is because the innie became an outie. So all of a sudden the bell button is not on the inside anymore, so it's protruding to the outside. And when patients feel it, it can be somewhat tender. Sometimes when that happens acutely, the patient may be doing some kind of effort, lifting something or going to the gym or doing some kind of effort that increases the pressure inside, and then something from the inside acutely goes through the hernia and it creates a lot of pain.
Okay. And I've heard of people, especially in exercising, lifting, what have you, who have a hernia but are able to manage it to a point.
Meaning not repairing it, manage it medically?
Immediately try to manage it. Would you suggest that?
No, that is one misconception. The hernias can be very small or can be extremely large. Everything depends on what's going on or depends on the patient and certain things. Taking into account a healthy individual that develops a hernia, regardless of the size or regardless whether the hernia is actually giving you a problem, it's a good idea to get it fixed. Hernias do not go away. Hernias will only continue to grow and can create problems and very complex complications that can last for a lifetime in the future. I always hear the term, well, it's not bothering me, why should I do something? Well, the idea of doing something is to prevent that hernia from giving trouble. So the smaller the hernia, the easier it is to fix. Come in the morning, get the hernia fixed, go home in the afternoon. You can do it electively, which means that you can arrange with your work or do family arrangements so you can get the procedure done. It recovers quickly, the risk of having another hernia is much lower, and the risk of complications are much, much, much lower if the hernia is small compared to much larger.
Now, people who do heavy lifting, people who do manual labor, or maybe they're what we might call a weekend warrior, and they want to get out, want to do something on the weekend, Is that the cause? Because, the conception is, doctor, that someone strains one time and boom, they have a hernia.
I believe there are several components to getting a hernia. probably the most important one is a weakness of the abdominal wall. So we are all built different. We all have different strengths. And there is some patient population that just have a weaker abdominal wall. Increased weight is probably the number one reason why people develop hernias. So the more weight you gain, the more pressure is in your belly, the more that your tissues will stretch, the thinner that your tissue will become. And at the end, any effort can create that hole, which is a hernia, that will end up with a protrusion.
So another campaign for keeping your weight down, staying at a healthy weight, exercising properly, I'm sure.
Absolutely,
Yeah.
absolutely.
Yeah. Dr. Holcomb, what do you tell people when they come to you initially with a hernia as far as being able to have the procedure done? Is it covered by most insurances?
I will dare to say, and not 100% sure, that 100% of the insurance will cover a hernia repair. And the reason why they will cover the hernia repair is because if the hernia is not repaired, can end up in a very complex complication that becomes a problem, not only for the patient itself, but extremely expensive when it comes for the insurance as well.
Yeah. And you mentioned something earlier about being able to come in and maybe it being a fast recovery time. What is the average?
So everything depends on the type of hernia that is being repaired. So if we are repairing a groin hernia, I let my patients go back to regular activities about a week later with minimal restrictions. About 2 weeks later, they have no restrictions. The incisions are very small. The pain is very little. Now, I always tell them you got to do things based on your level of comfort.
Okay.
If this doesn't feel quite right, don't do it just yet. But the medical restriction, depending on the size of the hernia, can vary from a week to 2 weeks to all the way to 6 weeks. The larger the hernia, the more restrictions they're going to have for a longer time.
Do women or men get more hernias? Are men more common to get them?
Men are more common to get inguinal hernias, and that's just an anatomic difference compared to women. Women tend to get more umbilical hernias, meaning belly button hernias, and the reason is related to pregnancy. During pregnancy, the abdominal wall stretches, and the actual defect, because our belly button is an actual defect. Everybody has a small defect at the belly button. Then when women get pregnant, it gets stretched and sometimes doesn't contract enough to become non-existent.
Now, you have to explain to me what the small defect in the belly button is.
Well, the belly button by itself is a scar.
Yeah.
And the belly button serves, when we are babies, serves for a vein and an artery to come through the belly button for the baby to be able to feed from the placenta. When they come through the abdominal wall, they leave a very tiny hole. When that hole becomes bigger during the pregnancy, sometimes doesn't go back to its normal size, leaving a little bit bigger defect, and that's how the umbilical hernia develops, or the belly button hernia.
All right. You mentioned 2 types of hernia. Are there more?
There's multiple types of hernias. There are tons of different ones. The most common ones are the inguinal hernias and the belly button hernias. The other ones we call the ventral or incisional hernias, which are hernias that happen where a patient had already surgery. So whenever we make an incision to cut the tissues open, when the tissues heal back together, only heal 80% of the strength of the tissue surrounding it. So that by itself will create a weak spot that can become a hernia in the future if there is too much strain or a hole is created there. There are more complex hernias like an obturator hernia, like hiatal hernia, spiculating hernia, which are very rare. Okay. The hiatal hernia is actually fairly common, but that hernia has a totally different way of treatment than the hernias that we're talking about right now.
You mentioned minimal invasive surgeries or procedures.
Yes.
Tell us about what a procedure is.
So a minimally invasive procedure is a procedure in which we do not make large incisions. We try to make the smallest incision to be able to perform the surgery that is needed. To give an idea, when a umbilical hernia is being done, depending on the size, the incision can be between 5 millimeters up to a centimeter through the very middle of the belly button, which at the end it will leave no scar, and the hernia can be repaired appropriately that way. When we're talking about inguinal hernias, we can make 3 incisions about that big, so about 5 millimeters to 8 millimeter incisions, 3 on the top of the belly, and fix even bilateral hernias if it's needed.
So forgive my crudeness, but you have an opening, you have something that's protruded out. How do you push it back in, and how do you keep it in?
So if we're inside the belly, let's say the room is inside the belly and we have a hole in the roof, what I have to do is go into that room, bring down whatever is coming out, and then patch it. We close the defect, meaning we put stitches to close it. If the defect is too big, we have to put a screen on it to reinforce it. We can fix it without the screen, but then the risk of recurrence is much, much, much higher.
You can fix it without the screen.
Correct.
But it's much higher.
The recurrence is much higher.
Okay, and so what is the life of that? Do you know the life of the screen? Would it last you in an ideal situation the rest of your life, or do hernias reoccur? Maybe a better way to ask.
Hernias will recur, and usually the two reasons why hernias will recur is gaining weight. Because if you imagine you have a screen that is protecting a defect here, the screen is not going to stretch along with your tissues when the weight is gained. So it can develop little defects at the attachments or surrounding the area of the mesh because of the weight gain. The other one is excessive heavy lifting. Now I can tell you one thing. The screen is so strong that even if a recurrence happens, it happens around the screen and never through the screen.
Got to go around it.
Yeah.
Okay. All right. Wonderful material. We're speaking with Dr. Jacome, and we're going to take a short break and be right back, so stay with us.
Portions of this program are brought to you by Fairview Park Hospital, a leader in healthcare for Dublin Lawrence and surrounding communities, providing specialty services through facilities such as our Sleep Center, Heart Center, and Women's Imaging Center.
We're back with Dr. Jacome, and thank you for joining us again, Doctor. Now, we're talking about hernias, ladies and gentlemen, and men, women alike get them. It's something that you need to address soon. We've established that, Doctor,
Yes.
that if you put it off, it's like any issue on
It
your
will continue
body,
to get
on your
worse.
home, on your automobile. Any issue is going to continue to get worse, so address it right away. So
Correct.
what do? Do you have to be referred from your primary doctor?
No, I mean, we don't request referrals. Patients can contact us directly, and I'll make sure the information is given. But if any patient or any person at this point is having a bulge or having pain at the groins or pain at the belly button, it's always a good idea to check your primary care doctor on request to be sent to a surgeon for evaluation. A lot of the times there's certain other conditions that may not represent a hernia, but it will be better to get evaluated in case it needs to be repaired. Again, the sooner that you repair, the faster that you repair, the less chances of complication, faster recovery, less chances of getting back a hernia.
Do you have exercise plans for people after having the procedure done?
No, once the healing process has been completed, there's no restrictions. They can do pretty much anything that they want. There are certain circumstances that will belong to that particular patient that I will specifically talk with them. The general population, small hernia that is fixed, there are no restrictions whatsoever afterwards.
But you probably would recommend someone who is overweight and has a problem with the hernia because of that weight to drop it, right?
Correct. So number one, dropping the weight will certainly make a huge difference in the recurrence rate. Number two, the drop in the weight gotta be well done. You know, it's not, we were talking about the people that, don't do nothing during the week, go during the weekend and over-exercise.
Sure.
So when it comes to exercise is like learning to walk. You gotta teach your joints, you gotta teach your muscles on how to do it to prevent injuries. So I always tell the patients, especially if they're overweight, to start slow. Build that strength so their joints don't go bad by trying to exercise.
Doctor, when you think about the procedure on hernia, you would think it happens to people 50, 55, and 60 and older. Is that true?
No, hernias can happen from a newborn baby to the end of life. Hernias can happen at any point, pretty much to anyone. And there not necessarily has to be a reason for a hernia to happen.
And again, the key symptom is something protruding?
The key symptoms when we're talking about a groin hernia is the sensation of something there, the sensation of pressure, a burning sensation or pain can happen. At the level of the belly button, most of the time is when, patients start looking and say, okay, I used to have an innie and now it's becoming an outie. Also pain and, and the presence of a little mass or a bulge there.
Doctor, how has your experience been here at Fairview Park and here in Dublin and Middle Georgia?
It has actually been great. I came from Augusta, and I do believe that this hospital, number one, is amazing. The people in this hospital, working with them, you truly feel like the person here at the hospital is willing to do whatever it takes to help the patients and to help us as physicians. And that is something very refreshing from other places that I've been.
Yeah, that's a wonderful testimony for our hospital. We see it in and out, but you being a doctor, you know the the procedures and practices
Correct.
and the people that we're dealing with here. So we invite you to call on the doctor, to check with your primary physician if need be, to get in touch. So we have the information here for you, and they can help you here, the doctor and everyone at Fairview Park Hospital. Thank you so much for joining us.
Thank
Doctor.
you. It's been a pleasure.